called AskDrLynn.com to identify, evaluate, and recommend medical marijuana for qualifying patients. Dr. Lynn is currently pursuing a professional certification in fitness and nutrition. And on top of that, she's a mom. I am so excited to have her. I'm going to bring her in. There you are. How are She's coming on. I'm excited about this because I think it's important for us to learn what these doctors are doing. Hi!
Hello, how are
How are
you?
you, beautiful? I feel like I know you
We
know
do.
you. I know.
It's
I
so
know.
crazy. We're really Insta sisters. So it's so odd how we build these relationships on social media and they're so real. And I'm
So
like,
real.
oh my gosh, my sister reached out to me. Of course I want to do this show. To be on the C-suite, like, hello, thank you. Such a pleasure.
I'm so happy that you're with us. And I just want to say, I watch what you do. I love the work that you're doing.
Thank
I
you.
really,
Thank you.
I
Thank
admire
you.
what you're doing. And I really appreciate how you go out into the community
Yeah.
and you're speaking to the people to help educate them.
Yeah.
And, so I'd love to just get right into it if you don't mind, because I want people to
Absolutely.
know who you are and connect with you. And if you're in the Florida area, Dr. Lynn is in the Florida area. Okay, so we're representing the East Coast, except
Yes.
I'm north, she's south. But Dr. Lynn, why don't you take us through your journey, like what
Gladly.
you do? I read your bio, but not only what you do, but how did that get you into cannabis? Because I think
Absolutely.
that's really important as we begin to see more medical professionals becoming more open to this plant-based medicine.
So happy you said that. Thank you so much for having me. As we did our brief intro, it's important to put context and just let the audience know and everyone on live know how much I've admired Women Grow for so long. And Gia is such an amazing advocate, and it's really an honor to be on this live with you. And I thank you for choosing me and selecting me, especially during this series where you're highlighting the medicine of cannabis, because that's really important. That's really what I speak to and I advocate for and try to inform as many people as possible in a simplified way about the benefits of cannabis and CBD and hemp and all that we can do with the plant. So happy to be here. A little bit about my journey. Um, I've always wanted to be a doctor. My mom will tell you that's always been my dream, my profession. It's what I wanted to do. I never varied from that. It was just a matter of how am I going to get there and what kind of physician do I want to be. So after graduating from college in DC, I did a 2-year internship at NIH, got some research experience under my belt, and then applied to several medical schools and ended up selecting Meharry Medical College as my institution and could not be more grateful for that experience. Um, Growing in an institution that is historically Black, one of the oldest, most historic medical schools that has done so much with a community of service. It really instilled the importance of giving back to our community, and it really made me realize that I don't do it for myself, but I really do it for others. So that was my foundation. And coming from there and going to Morristown Medical Center for emergency medicine residency for 3 years, it was two completely different environments. So it took some time to get adjusting. First of all, I'm in Morristown. Second of all, I'm in a very highly demanding trauma level center. So it was a huge learning curve. You had to really jump right in and kind of, find your footing. So that was a challenge, but yet the best experience because I had access to every possible intern and resident and subspecialist and specialist. And that's really where I got to grow because if I didn't know what was going on, there was always someone that I can access to help guide me. And
Mhm.
having that training just really set me up for a diverse experience down here in Miami, Florida. As you know, weather and location really influence your population and the lifestyle. And what we saw down here is a huge amount of people visiting the area. So we got a lot of out of towners. We have a lot of water activities and accidents and things like that. We have periods of high influx in population. So understanding mass casualty That's why coronavirus and other pandemics that have, affected us over the last couple of years, we've been able to take it in stride because we're used to this influx. We're used to kind of, honing down and zoning in on how to manipulate the situation to work for the best and the advantage. But that was my medical journey personally. After graduating from Morristown for ER residency, started down here about 5 years ago, almost 6 years in Florida. I understood as an ER physician that I'm going to see a little bit of everything. And not only that, I started to see a lot of drug overdoses, and more than just your regular basic cocaine overdose or, opiate overdose. I started seeing a lot of polydrug overdoses and designer drugs that were compilations of several different narcotics and opiates and benzos, and we couldn't recover the patients because it had such a profound effect on depressing the respiratory system or the mental status. And it really was difficult to try to figure out how to bring these people back. Do we just wait the time out? Is the half-life of the drug gonna, resolve soon and we'll be able to get them back? Do we just put them on a ventilator? It was very challenging because there were so many different components in these mixed designer drugs that they all really, kind of took over and made it difficult for us as providers to catch up and to support them. Respiratory wise, mental state wise, oxygenation wise, whole body compensation, it became a challenge. And I saw that in a lot of visiting individuals and a lot of young population people. And I said to myself, there's got to be a better way, whatever your intention or your purpose is for what you're doing, there's got to be an alternate. And it really prompted me to start to explore more complementary medicine and alternative and holistic medicine. So that was my initiation into cannabis. And that's really what opened the door for me to say, hey, there are other options out here. I didn't learn about it in medical school. The only thing that I did learn about is that cannabis is bad and cannabis has side effects, and those are what you should watch for. So it was always had a negative connotation when it was taught to me in medical school. There was never any discussion about the benefits of the plant. So everything that I discovered over my last 3.5-year journey has been self-taught and self-read, and just really jumping into the industry and reaching out to other liaisons and people who have been doing this for years, learning from the research that's been published, reading several different books about cannabis, and trying to understand the ECS system as best as I possibly can in order to be able to manipulate the ECS system and use it to its maximum advantage to enhance the wellness of CBD and enhance the benefits of THC. So it's really self-learned over the last few years, and it's just kind of grew from my passion in wanting to offer people an alternative to some of our traditional or big farm, opiates and benzos and other things that people might be using or even sometimes abusing to try to relieve their pain or relieve their anxiety or their depression or their stress or whatever it is that you're trying to manage. So
that's a perfect segue, because how have patients been responding to you, right?
Yeah.
And the reason why I'm asking you this is that we've learned that many patients have brought alternative medicine to the attention of their doctors, and because they weren't informed, oftentimes have persuaded them to not use it, or just simply said they didn't have enough information. And so you have a doctor like yourself who now has self-taught herself, right? More about plant-based medicine, I'm sure through research, and of course you've got your formal education and your day job, so to speak, right? But how are patients responding to you, and how are you advising them between the choices and the options?
Great question. So how are patients responding to me? Usually if a patient is coming to me and pursuing finding out a little bit more about THC and cannabis and CBD, they are interested. And as long as your interest in your mind is open, I can get in there. I can penetrate and I can give you the information you need. If you're completely closed off and have no desire to learn about alternative medicine and complementary medicine, then there's a dead end in our discussion. There's a discrepancy in the audience. So I find that the patients who are searching out for me and finding me are those who want to learn and have the desire and have the aptitude and are trying to figure out ways to reduce their medication list and seeing how they can kind of wean off of some of the things that they've been on for so long and try alternative brands and alternative means to creating a more natural pathway to health. So I have had a very warm reception amongst the patients, but again, for what I do, I don't seek patients. You know, I'm not going out there looking for patients. I'm not advertising. Everything I do is through social media and word of mouth. So the patients that find me and are searching for me are searching for that knowledge. So they're hungry. So by the time they get to me, they're like, what can I learn? What can I do? Like, look at my meds list. Like, how can we figure it out? They are very proactive. So I'm very happy to have an audience that is excited. You know, they're excited, they're interested, they're curious, and I'm very glad to welcome that experience. I don't have to convince people by the time they get to me. They've already done some research. They just need some clarity and guidance. So it's so really good for me.
That's so important. And I do have a follow-up question to that. But the reason why that's so important is that, as you said, you don't have to convince the patient to be open. They're already open, whether they're informed or not, right? They've heard enough to say, let me go to a professional or seek a professional that perhaps could help better educate me. And so I want to get this question right, because one of the questions that I've asked or I put forward to you is, what about patients who are medically undiagnosed, right? And do you believe that they should consume the plant without seeking medical guidance? Or, you know, in terms of like proper dosage, right? Because again, when we think about this is a medicine, and I want people to understand, which is why I'm doing this whole medical theme, is that while it's a plant, there is also a certain amount of dosages I believe our bodies need to have. But I think that some people, which is why we're often referring to it as over medicating, right? And now they then have to find that balance. And so if you can explain to us, for patients who are out there, and I believe we're all patients of the plant,
Absolutely.
but patients who are perhaps going undiagnosed, you know, do you believe that they should be self-medicating on their own, or should they go out there and seek a professional like yourself to figure out a plan and a strategy to better own their health management?
Excellent question. Should patients try to initiate treatment on their own before seeking professional help is the question. And I will say, as a patient myself, and even being in that position, I come from a West Indian background where our first and primary goal is to self-treat. So if I have a tummy ache, there's a tea for that. If I have a headache, there's an oil to rub on my temples. If I have, you know, any kind of ache,
you see, I told you I was drinking my tea.
There's an aloe for that. There's, you know, I come from a natural background growing up in Jamaica where we've always self-diagnosed and treated prior to seeking professional help. That has been the last, you know, option. If I'm actually at the doctor's office and in the hospital, there's something seriously wrong because I couldn't manage it myself. So when you come from that background of, you know, being self-sufficient and trying to self-medicate as best as possible and diagnose, you can't help but respect that is what people do. No one's picking up and running to the hospital in this day and age of Corona, much less uninsured patients who can't afford an ER visit, much less, you know, impact and continuity of care and all of those things, and lack of accessibility for doctors. You know how many times I see people in the ER and they're like, I just can't get my doctor on the phone. I can't even schedule a telemedicine visit. So hence I'm here. So it is, whether it's right or wrong, necessary, unnecessary, it's what we do as humans, and it's what we have to respect. So when you come, you know, and present to me at that point, it's like, okay, what have you done? What have you tried? Let's understand where we can better guide you. And let's understand the timing of your medication. Let's understand the dosing. When are you taking your other medications in addition to that? Is there any potential for cross-reactivity between your hypertensive medication or your anticoagulants with the CBD or THC? Are you trying to achieve sleep relief? Are you trying to retrieve better creativity? Should you be using an indica or sativa? There's a whole new culture, language, vocabulary that comes with cannabis that I'm still learning. I can't even tell you all the different strains and the different hybrids and the shatters and the, there is so much to learning that you have to really teach yourself before walking into the dispensary, because you can get persuaded in different directions. So a lot of what I do is preparation for the patients. Like, let me tell you what your experience is going to be like. Let me tell you what to watch for. And back to the question of, is it right or wrong? It's a fact of the reality of what we do. We all try to treat ourselves before ultimately ending up in a doctor's hands.
Absolutely.
And I have to meet you where you're at. I can't chastise you. I can't, dissuade you. What I have to do is grow with you and make sure we're doing it together. Because if you present like, I tried the CBD and I did the 2 milligrams under the tongue and it didn't work, before becoming turned off and losing a patient, let me try to help you navigate the process and see where we can find a better pathway where it can be more effective, and make sure you're using the right dosage and with the right intention. I really try to inform patients that your intention is what's going to deliver your outcome. So there's recreational, there's medical. What your intention is your purpose for behind using it. CBD, I really try to promote as a daily wellness additive to your mental, physical, and emotional health. It's not an episodic treatment, whereas THC has more of a pain component, a pain relief component, and it can be used more episodically. So understanding the difference between the two is important for your daily treatment versus your immediate, relief from some kind of ailment or concern. And trying to help patients navigate that process, it's important for me to be involved and to be open and to understand all the other supplements that you use in addition to your 3, 4, or 5 prescribed medications. So that way we can really decisively figure out the timing of the dosing, because the timing, the absorption, all have a huge impact on the effectiveness of the plant. So
absolutely,
it's really critical that I help patients navigate that process. But many patients come to me before they've ever been seen by a physician. They just know that feeling like, hey, I feel nervous when I go outside. I'm anxious being in a room of several people. I had this incident before in my childhood that's really lingered with me. That's undiagnosed anxiety. That's undiagnosed PTSD. That's undiagnosed depression. That's undiagnosed, several different things that we have to tap in. And because you have not had a clinical diagnosis, does not negate that your experience and your feelings are not valid. So I really try to help patients see what your experience is. This is trauma. This is, this is mental illness. This is stress. Just trying to identify and put language and diagnoses to what they have been experiencing for so long that hasn't been formally, treated or formally diagnosed. So I meet patients in that path and that goal. I help to meet them and help them to understand that this is not a stigma. This is, because I'm saying that you have clinical depression, that is not to categorize you, but it's to help you get to the right pathway for what you need to help you relieve your symptoms and live your best quality of life. So it's just a matter of being an open practitioner and understanding that the only way to really have an involvement and an impact in your patient's life is to be able to, really understand what they're going through and allow them to speak freely with you, build that trust, and make sure that you are helping them in terms of guidance. Because as you said, it's a medicine, it's a plant, and it has several potentials for interactions with particular types of drugs or particular types of medical problems like liver disease or coagulation issues. There is the potential that you could have negative side effects from it. So understanding your dosage may be too high, or the time of day you're taking it might be wrong, or the strain that you're using might not be appropriate for you. That's where I come in to help clarify all that and navigate that with you.
It becomes a partnership.
Yeah, absolutely.
I love that you used a term that I wish I had written down, but I am more into, I don't know who's watching, but I'm going to tell you, I'm just as into this as you are, because that was such a great response to the question. And I really appreciated what you said, because oftentimes you're absolutely right. We all self-diagnose, right? Yeah. Which is why we have medicine cabinets, right?
And as soon as we feel
a bit of a pain, right? Over the counter, we're like, oh, I got a headache. Let me go get something.
Exactly.
And so you're absolutely right. It's only unless we have something that is consistent, that is a continuous feeling that you're like, okay, this is more than what I just took. Let me go see my doctor, right? We really diagnose and become our own, medical expert at that point.
Absolutely.
But you used a term that I wish I could remember. It was like practitioner openness or something.
Yes, just being, just as a provider, the importance of being open and trusting with your patients. That's how we're going to build our repertoire. If I come in the gate saying, you need to lose 30 pounds, you need to be exercising, you need to do this. If I come in the gate, pushing all that on you and essentially chastising you for how you have been living for the last 30, 40 years, we're not going to build that relationship. So it's important for me to understand where you're at, understand how you got to where you're at, and, try to see how we can help each other in the process to make it a mutually beneficial, relationship. Because if not, it's not going to work. I have some patients that have tried it once and said, did not work. So those patients, what I really try to hone in on is, okay, let me help you understand. This is not a one-time thing. This is an art. There is no descriptive prescription. It is a recommendation. And with that recommendation, there's an art to creating a customized, way to deliver it for you.
A type of regimen that would work and align with our bodies. I hear that often, and I can give you 2 examples. Whereas, we often hear someone say, I smoked once and that's not for me. And I'm thinking, well, there are other options. Did you know that? And the surprise and look of people is that they immediately think, oh no, I had that paranoid feeling. I hate that. I'm like, well, that really depends. Again, let's look at this for what it is. It's medicine.
Right.
It's no different than if your doctor were to prescribe a medicine to you that didn't work. What do? You go back and say, doc, this didn't work for me. What else can you give me? Versus, Dan, I don't want to use it. It's not for me. Exactly. And so it's a way of how we're looking at it. And that's why I think it is important. While we do often self-prescribe, I think it is important that we do find that medical practitioner who's willing to work with us to figure out what works best. So how do you feel about patients growing their own?
Oh, I'm all for it. I'm all for it. Absolutely. And I'm hoping that, once our state in Florida, gets its new leadership, that they'll be more open to allowing patients to grow their own. Because the truth about the matter is it's expensive. And that's my biggest turnoff for the majority of clientele. I may propose it and I may say, hey, are you interested or something like that? But what I really make sure that people understand, it is a financial investment in your health. The card is $75 annually. There's a doctor's fee. Your initial fee is anywhere in the range from $200 to $350. Your refills are anywhere
and that's only in Florida, because it's different from state to state. Absolutely.
Your refills, average $100 every 7 months. The product that you purchase is cash. There's no credit at the dispensary. You can't just pull out your Amex. It's all cash. So I make sure that before patients commit to this type of lifestyle modification and change, that they understand the financial investment, because it is much cheaper to go get a bottle of Tylenol over the counter for your headache, or go get your Percocet, which is probably free with your Medicaid, rather than spending and investing anywhere from $35 to $65 for a vape cartridge. And you got to buy the pen. So, just
That's right.
understanding that it's not affordable for the majority of people. But what we want to do is offer options that are thoughtful, offer options and discounts in any way that we can, whether it's discounting our cards prices for the veterans, whether it's taking advantage of, regular sales and things like that, but making sure that they know this is an option out here for you, but it is a financial investment. And if you want to do it one time, don't invest the money. I absolutely don't let patients come in and say, I just want to try it. This is not something you just try one time.
Right.
You have to really make sure that you're committed to at least a 90-day process with me.
Yeah, because your body has to, I told someone that so to that point, sorry to cut you off, but I get messages all the time, and even from friends and family, and it's always funny to me that I've been in this industry for quite some time, and now only like my family's just getting around to it, right? And so I'll get the message, hey, I want to get a card, or hey, I want to I want to get a card because I want to get some medicine. And I have to say, well, first of all, if you're in New York, we don't have flour. Right. So if you're looking to smoke, that's not happening. And then I have those who want to grow their own. And while I am for home grow, I've also had to explain to people that's not always easy. It's not just a house plant. and you have to understand that is just as much of a commitment as it is going to the dispensary and shelling out that cash and allowing that medicine through your body, growing it. And so I love that you said that you're Caribbean, because I come from a Caribbean background, right? And God rest my Uncle Freddie's soul, but my Uncle Freddie, my entire life smoked weed, right? And so that was his medicine. He grew it. He did whatever. My Uncle Freddie was in my opinion, and when I look back today, was the expert, right? He knew different strains. He made teas before he understood. So those were things that were around me. I didn't know, right? But he also cared for his plants in a way that, I just thought he was just being extra careful because he loved weed, right? But no, when I get into the industry, I learned that you really have to care for this plant in a particular way. It's not like growing a regular house plant.
It's not a cactus.
And so,
it needs a lot of love.
It needs a lot of love and a lot of absolutely. There's always a science behind that. But I agree with you that home grow, I think, would be far more affordable, right? For patients and for governments that are out there thinking, well, you lose so much money. First of all, it is not they are growing, ounces and ounces. It cracks me up. If you actually had the true background of what home grow is, and one of my team members, for the first time this year, he grew 12 plants in Massachusetts. And he was like, so weeks later, he's like, I'm still trimming. I'm like, how much goddamn trimming are you doing? He's like, Gia, it is so much work. He was like, I used to grow only 6 plants. He's like, this year I grew 12. And it is taking so much time. He was like, next season, next harvest, I'm only doing 6. And so while we are for home grow, and I do support it, understand that is not an easy feat. It is a job. Geographically, where you are, if it's outdoors, that's one thing. If it's indoors, that's another thing. There is such a science behind that. I got off the subject, but I agree with that. But I guess one of the questions I have, because you're a mom, which makes you a canna mom. How do you have that conversation with your daughter, or is it daughter, son?
So my daughter, Mila, is 11 years old, and my niece, Zoe, is 13. So when I started, they were a little bit younger. I started about 3.5, 4 years ago. And as I kind of got into it, it took good conversation, good language, and good narrative. Of course, they're supporting me 100%. They're wearing my merchandise and they're like, what does Ask Dr. Lynn mean? Like, what is that? You know? So I had to make sure that they were savvy and make sure that they knew what they were promoting and what our brand and our legacy is. So it was very important for me to have those conversations with them early. And drug conversations early for this age is never too early. Kids are exposed to everything out there with the internet, with, you know, private school, with public school, with, you know, just social media in general. They have and have seen anything from Molly to base to crack. They've seen it in movies, they've seen it on TV. So it's never too early to start having these conversations with our children and helping them decipher medication from drugs, right? So with our conversation about cannabis and marijuana, that just happened without me even, you know, kind of bringing it up, because it was so profound in the news at that time. 2 to 3 years ago, it was overwhelming. What is CBD? What is THC? What does that mean for the impact of your state? It was, you know, in every media outlet, it was starting to infiltrate mainstream television. You would see conversations with parents and kids about smoking versus vaping versus Juuls, and what are all of these things that you're being offered. So it was just a very natural conversation for us to begin, even though you would think maybe they're 8 years old, maybe they're 10 years old, it might be too early. It wasn't early enough. So helping them understand what that is and what cannabis is and what we're doing with cannabis was the main focus of the conversation, and understanding the importance of how it can help and not only hurt. You know, because cannabis has advantages and disadvantages. So we always acknowledge that. And we acknowledge that there's the potential to go overboard with certain things. No one's ever died from cannabis overdose, but there are side effects that make you not feel good. So understanding what that looks like and how to recognize that in your friends and yourself. Yeah.
Yes.
So making sure that you know that distinction, that medication has side effects. Good medication has side effects, bad medication has side effects. But those side effects are real. And when you're going through that moment and not feeling well, seek help. You know, don't try to ride it out, seek help. So we have very open dialogue. They know my vape cartridges, they know where my pens are, they see where my flour is, they see my edibles, they see everything. So it's never a secret as to what I use or what I have or anything like that. And I told them, if there comes a point which you feel like you ever needed to try something, don't try it with your friends. Try it with mom. You know, try it with your auntie. Make sure that we're doing it responsibly. I'd rather you come to me and I be your first vape than you going out there and trying some product with somebody you don't even know. So helping them understand that this is what I do. This is, for me, an adult resource. I don't prescribe personally for children, even though it is recommended for pediatric use. That's not my background, but this is an adult resource and it's an adult medication. So helping them to understand that and making sure that they are not in any way shielded from the industry. And when they do have conversations about it with other children, or they may hear their other children's parents, you know, overhear them talking, that they have the correct narrative and language about not just the popularity of the plant, but the importance of it. And that is, you know, critical, because what we're trying to build, my sister and I, is a legacy. And we're trying to make sure that the narrative is for information and education and upliftment. And if we can't do any of those things and we can't funnel that into our children and our family, then what are we doing this for, you know?
It's such a, first of all, I commend you for doing that. And I love that it's a family affair in terms of you and your sister doing it. But I think it's so important what you said, because there's so many Canna moms out there who are facing stigmas from the community, right? And pushback from the community. There are Canna moms who are hiding it from their children because they're unsure how to have that conversation. And I think that's so important that we are open. And I believe in having the conversation, you know, the conversation while I was growing up was don't do drugs, right? This is your brain on drugs, don't do, you know, that whole, you know, horrible misuse of information that was rolled out to us, because while telling us no and telling us what it will do, there still wasn't useful information in that. And I was just on a podcast interview and I said, I wish when I were in school, if there was a correlation of helping me to understand science and maybe using cannabis,
Hmm. Hmm.
either way, I'd have been in AP cannabis, okay? I want you to know that. I would have, because it's fascinating,
It
right?
is.
And then it takes away from the whole stigma
Hmm.
around it,
Hmm.
right? You then begin to understand the science and medicine behind it, and you're curious more than wanting to take advantage. And when I mean advantage of it, not advantage like overuse,
Right.
right? And so, but advantage in a responsible way. And
Responsibility.
so
Perfectly said.
it's so important that we do have these conversations with our children. I know when I got into the industry, and at the time my daughter was in college, she now works for my company full time. She's 26,
Right.
so
Right.
she's a full-on adult. But I introduced her to understanding what vapes were and what CBD and tinctures were. And
Right.
I spoke to her even before she went off to college. We had the conversation. We've had the conversation about alcohol. We've had the
Hmm.
conversation about cannabis and anything else out there. And I've told her, come to me first. Because first of all,
Hmm.
don't get it twisted. Mom has probably already did it and does it better than your friends.
Exactly.
So they're not going to know more than me. I have a hell of a lot more. My resume goes deep, right?
And
So,
my supply is better. My supply is way better than any black market dealer that you got out there.
right.
So
So
let's
like,
do some good
talk
stuff.
to me, and but it allows for it invites that
Yes,
conversation, right?
definitely.
Versus being apprehensive about coming to the parent to have that conversation. So I commend you for that, and I hope to any Canna moms who are tuning in. Go back and listen. Like, it's so important that we do identify the Canna moms, right?
Right.
Because again, when you think about the stigma around the cannabis industry, they'll even look at moms as being like just lazy and unresponsible. And I'm like, are you kidding me? The canna moms that I know,
Hmm.
they
A
are
lot.
badass. Like, they
Absolutely.
are amazing women no matter who and what they do. Whether if they are your nurse, they're your
Yep.
doctor, they are the woman at the grocery store,
Yep.
they're badass women. And so
Absolutely.
to really put that on a parent, I would never look at a parent who's on any of those other drugs that
Right.
were and say they're a bad mom. So don't do that. It's wrong.
Don't
But
shame
I
your Canna moms. Don't
no,
shame them.
let's stop
Absolutely.
shaming the canna mom. There's an
So,
amazing T-shirt out there. I'm sorry,
no,
but
I
I
just
just want
wanted
to.
to say your
Go
point.
ahead.
No, say your point because I know I'm going to forget it. I was writing mine down too.
There's just a T-shirt out there that says like, first I smoke, then I do my job, or like I do,
Right.
and it's like really supporting the moms out there. And I'm
Mhm.
like, yeah, you got to get it done. But I'm so sorry. Go ahead.
I was going to say, I want to see our community as a whole get to the point where vaping your medicine or using your tinctures or using your pre-rolls or whatever it is becomes so natural as taking a pill. I want to see us get to the point that our technique for delivery doesn't have to be concealed, because we don't do it in the typical fashion of big farm as popping 5, 6, 7 pills a day. That doesn't mean the delivery method that we're using is not important. And I would
Spot
never
on.
want my moms or my patients or anyone to feel that because I'm doing this quote unquote differently or alternatively from what has traditionally been projected and recommended, I always want them to know that what you're doing is true to you, it is helping you, it is benefiting you, and you should never feel in any way uncomfortable or shamed or feel like you have to smoke in your car and then go to work. Like, I want you to
Right.
feel very free with it, and I want you to feel that no one's judging you for it. And I love when I'm driving and I'll pull up next to somebody and I'll see them hitting their vape, and I'm like, yes, that's what I'm talking about. Don't ever make anyone else shame you or make you feel uncomfortable for taking care of yourself.
I
That's the
agree.
the biggest thing to me.
Absolutely. And so it's a nice segue into taking care of yourself, because I shared with everyone that you are becoming certified in fitness and
Yes.
nutrition,
Hmm.
which I see that goes hand in hand with plant-based medicine. In the last season of C-Suite, we had Dr. Caroline Hartridge, who definitely promotes plant-based foods along
Hmm.
with plant-based medicine.
Hmm.
And so we know in this industry that fitness and nutrition go hand in hand with cannabis. There are people who are doing, cannabis and yoga and
Yes.
cannabis and fitness training.
Hmm.
So tell us why, if you don't mind sharing, why the fitness and nutrition aspect.
Absolutely. So, personally, my journey with fitness has always been stress relief. That's been my outlet for many years, from when I joined my first gym at 16, working from classes and building up your way to do it private one-on-one sessions to ultimately helping others train. My journey has been, I use that as my way to decompress and not only to physically feel better, but to mentally clear my mind. So that is my personal stress relief. So that's why it's a
Mhm.
passion for me. And then understanding the benefits of using different CBD infused waters and how that helps to increase your stamina or increase your energy. Understanding that you can pre-medicate with certain strains of THC to prevent soreness in my knees, to prevent muscle, you know, acid buildup and things like that. So understanding the relationship and timing of when to use these components to make your workout the best possible workout is what I hope to bring to the industry. Shout out to my gym, Legacy Fit, out here in Florida and in Pines location. They do a great job of marrying mental, physical, and spiritual all together with the fitness and
I
health
love
aspect
that.
and component. And I just hope to be able to enhance that by adding CBD to my regimen with that.
Dr. Lynn, is that why many of the brands that we're seeing that focus on nutrition within the industry have a pre-workout and then a post-workout in
Right.
terms of strains or gummies? Is that why we're beginning to see more of that in the marketplace?
A lot of that is marketing tool and technique, you know? So when I tell you take one before and one after, it's very easy for people to do. If
Hmm.
people have to think about it, if they have to figure it out, it becomes less regimen for them, and it becomes more challenging to try to fit it in. So a lot of that is marketing tool and technique, but the science behind it is as important as it is to stretch before you work out, it's equally as important to recover your muscles after you work out. So making sure
Yes.
that you have the right, additive pre and post are critical to building the best body, to making you stronger to
Hmm.
do it the next day and the next day and the next day, and really
Right.
preserving yourself for future workouts. So there's two components to it. Of course, they always try to target in marketing, you know, take one a day or take this or take that, and that's just marketing as for what it
Right.
is. But
Right.
medically, it has been proven, and if you're taking the right ones, it has been proven that you can benefit tremendously in your muscle density and decrease lactic acid buildup and increase flexibility, stamina. All of those have been proven to have benefits from using CBD and THC. And now, when
Hmm.
and timing and where and how, whether it's dissolvable in your liquid or vaping before you
Hmm.
go in or tinctures, like all of that is a whole nother conversation. But yes, make sure that you're reading the fine label print and make sure that it is doing what it's supposed to do. Because the additives in a lot of these are things that you're taking anyways, whether you're taking creatine or protein or,
Yep.
all of those kind of are built into one, whether it's capsule or tincture or shot or
Hmm.
whatever it is. So it's
Hmm.
just kind of
Hmm.
making it a little bit easier for you to utilize the product.
Dr. Lynn, how can people find you?
Oh, people can find me on my website, askdrlynn.com. Of course, I do a lot on Instagram. That's my main social media outlet. Similar, askdrlynn.com. Very easy. I keep it uniform between that and YouTube and Facebook and Instagram. But my main source of interaction is through messaging, DM messaging, and Insta messaging through Instagram. And they can also text me directly at 305-487-0902. All my patients have my personal cell phone number. They can always call the office. It's never a problem. Because of my schedule working days and nights, I have very odd hours and, you know, you can always reach me 9 o'clock at night versus, you know, 6 o'clock in the morning. I work different hours. So I'm a non-traditional doctor.
I love that you're accessible to people,
Yeah.
and that is also important. I want to thank you so much. I mean, the time went by so fast. I'm like, I cannot believe this. Thank you so much. Please do not be a stranger.
Absolutely.
I know that I will be reaching out to you again.
Please do. Anything I can do to help. I uplift you. I applaud Women Grow. I think what you do is amazing for the women in our industry. And it's a very small industry. And we hope to use our networks and our outlets to channel that, to be able to make women feel more comfortable and, you know, really put them in a position of power. Because where you're at and where you started, your journey has been incredible. So I've watched it, and I'm so glad and grateful to be present with you today.
And I appreciate you, and we're going to continue to uplift and applaud and support you. And, you know, we repost your information because we find it so valuable. Thank you so much. And I've tagged your handle so that anyone that is wanting to follow and get in touch with you, they'll be able to do that. And we'll make sure to repost this after. Thank you so much.
Yes,
have an amazing day.
Shout out to all our amazing comments. We're sorry we didn't get to
I know
directly, but please reach out to us, you know, individually and collectively, you know, comment under our post. And when Gia reposts this live, make sure you comment, and we will definitely address them as quickly as possible. Thank you, everyone, for the interaction and engagement.
Thank you so much, Dr. Lynn. Take care. Bye.